Assalamu alaikum. So this video is about the COVID-19 outbreak and what it has done to the world and where we are heading actually. So I won't go into the details again of how it started. We all know that. But what it has done is that it has stopped all the economic activities around the world. Airports, business centers, schools, colleges, universities, everything has come to a stop. Now, it's important to understand that whenever there's a pandemic, there is for sure a panic. There's a greater panic attack than there is the threat of the real pandemic. People around the world are more threatened by coronavirus than they should be. Coronavirus kills mostly people who are aged above 50. If you can go into the stats and look around, I'll put up a graph in the video also to show how most people above the age of 50 and specifically above the age of 65 with conditions like chronic heart diseases, tuberculosis, cancer, these are the patients who are actually dying. These are the patients who are actually in threat. And news coming in of deaths from countries like Italy, Spain, and other European countries. If you look at the demographics, if you look at the population divisions, you find out that over 50% of Italy's population is above 65. Now imagine every 100 people walking around in Italy, almost 50 and more than 50 of them are elderly people. People have better life care there. At the same time, they are less immune to such flus and new viruses. Now, there are lots of people dying, yes, but those numbers are not really scary, to be honest. How? Have you ever heard of how many people in Pakistan, how many people in Australia, how many people in the United States have died in a single day from malaria? Have you ever heard over news that everyone is talking about how many people died in an accident, how many people died out of a common flu? We've never heard of those numbers, but now everywhere, if there's a patient of cancer and he's got a flu and he's COVID-19 positive, you say, Corona killed him. If there's someone suffering from cancer on a deathbed who was already evidently going to pass away, you blame Corona. And all these numbers coming in from all over the world are creating a big hype of what Corona really is. And yes, it is more deadly for people over 65. Young people out there, take your necessary precautions. Keep yourself safe. How would you react if there was a rainy day outside and you could catch flu? How deadly did you feel that could be? You never felt anything about that because you never had the numbers that how many people die out of common cold. And now that you have numbers, you're so scared to go out and help people out. It is more deadly to elderly people. And what's the best way to isolate these people from you? Keep these people away from you yourself. Young people should stay away from the elderly so that even if you are COVID-19 positive, even if you've gained this virus somehow in your body and you're carrying it around and you're not really affecting or showing those symptoms because there's so many stages of it and you may be, or I may be one of the carriers myself, unless checked obviously, just keep your elderly, your grandma, grandpa safe. Just don't get in contact with them. Don't sneeze or cough and talk or, hang around with them too much. So that's the basic message. Don't blow it out of proportion. COVID-19 is dangerous, yes. And so is hunger. So is every common flu out there. So is tuberculosis and cancer. Everything brings you to death. And that's what we all are going to face one day. We're all going to die. So what's the great fear for? So take your precautions, go about your day, stay away from elderly, keep them away and safe at your homes, and we'll be through this one day together.